So where are you from?
I'm from LA.
Los Angeles.
Yeah.
Yeah. Did you fly here?
Yes.
Or you drive here?
No, we flew.
Okay, just checking.
Yeah.
I've had people drive from California, believe it or not.
Oh my.
So why are you here? Can you tell me?
Yeah, actually I was doing some research online to find a way to deal with TMJ. I've just been dealing with it for so many years, and I found your videos on YouTube. It was one of those random things, and I think it was just like 45 minutes in her TMJ or something like that.
Yeah.
And that's the first video I saw.
She was the LA girl.
Yes, in fact. And so I said, golly, somebody went from LA. I was like, hey, why not? Go to Branson, see what's there.
Not much. Not this time of year. Tell me about your problem.
So about 97, 98, somewhere around there, I ended up having some pain that had developed over here. And it was pretty severe at the onset.
Yeah.
And I went to somebody who specialized in dealing with pain.
Like an MD or a dentist?
Honestly, I don't remember, but I think he had been trained as a dentist, actually.
Okay.
So dealt with the initial problem, but it just kept coming back. I probably had 5 or 6 different type of night guards.
Was he doing dry needling?
Yes.
Right.
Yeah.
The needles in certain places, trigger points, and all
Yes, exactly. And I would just go see the dentist regularly. I never brought it up. I never said, "Oh, I've got all this," because I didn't even think to bring it up actually.
Yeah.
Until it just really got to the point where I couldn't take it anymore. So I always dealt with the fact that I was clenching and grinding and knew I couldn't wear my teeth down. So I would say, "Hey, I know I clench and grind," so they would
Right.
make a night guard. But this last one was a small one. It was hard and just in my front teeth.
How long did you wear that?
I've worn that for about 2 years.
Yeah. I was telling you earlier.
Yeah.
That's not a good idea.
Yeah, I know, and I had no
They
idea.
didn't tell you. Yeah. I know. I realize that.
Yeah.
Most dentists don't know that. You don't ever wear those anterior deprogrammers, the ones that touch just the front teeth, longer than a few weeks.
Yeah.
That can actually crush the disc. Excess force.
Well, I didn't wear it last night.
That's good. So, in a typical day, what are your symptoms like? Do you have headaches, clenching?
I would say most of the time I try to, if I feel like I'm clenching for whatever reason, or maybe if I'm smiling too much, I just feel like every time I smile, it's just painful actually, especially on this right side. And in the morning, I'd wake up, it varied. Sometimes my pain level would be maybe at a 3 or maybe be at an 8, it just depended on what happened during the night, in which I had no control over.
So as the day goes on, you feel better?
Sometimes, yeah.
Yeah.
Sometimes I did, and but I know sometimes it would feel like just the same throughout the whole day. It varies.
Right.
But usually it's always there. It never goes away completely.
There's never a day where you're not aware of it.
Right.
Can you chew gum?
I can.
Does it make you tired?
Yeah, I don't chew it for long.
Right.
Like, if I don't have time to brush my teeth or something, and I'll chew a piece of gum, and I'll say within 5 to 10 minutes I'm done.
Sure.
Yeah.
Right. And then you feel sore.
Yeah, very sore.
Yeah.
From
Understood.
chewing gum. Mm-hmm.
Do you get headaches?
Occasionally.
Can you point to where they happen when you have them?
Somewhere like up in my temple area, and sometimes just in the front over here.
Is it usually on the right side only?
Yeah, I don't ever feel like I get headaches over here. This feels like it's pretty much fine all the time.
Yeah. Do you ever notice yourself sticking your tongue between your front teeth?
All the time.
All the time.
All the time, yeah.
Yeah, even in pictures. I've heard that before. Have you?
Yeah, I haven't thought of that, but yeah, I probably do. I'm gonna have to go look now.
You go look now, right? Yeah. Are your teeth cold sensitive?
Yes. Yeah, and I had never. Yes, really bad. I specifically asked to not have ice all the time, and if somebody gives me a water bottle, I'm like, is it room temperature? Because I'd rather have it be room temperature.
Take the ice water, swish it around if you can for 5 seconds. Tell me what it does.
Okay, that's not pleasant.
No? 0 to 10. 10 is unbelievable pain.
Yeah.
0 is nothing.
No, I would say it's like a 6 or a 7.
How about your neck and your shoulders? Do you ever have any tension or stiffness there?
Yeah, I'd say most of the time my neck feels pretty tense.
Both sides or just the one?
You know, my whole neck feels tense, but what's peculiar to me is that my right shoulder feels tense all the time.
Right.
It feels like...
Even now?
Yeah, even now. And it feels like, I don't know, I've seen chiropractors, I've been to massage therapy to, try to work it out, and every single time I get a massage, the person working on me says, no, you really have more troubles on your left side than your right. So I said, well, that's kind of weird, because I feel it on my right.
This is
A little bit sore.
a little bit,
Mm-hmm.
and this side,
Nothing.
nothing. So that's like just a finger.
Yeah. That's a little bit sore, yeah.
Yeah, and that's consistent with the same.
Yeah.
The pain is usually on your right side, right? And the temple is where you get the headache?
Yeah.
Okay. This side you don't do, it's okay.
Yeah.
You're pretty much unaware.
Yep.
How about popping and clicking? Open for me.
It'll be on the right.
Yeah, I feel a little bit right in there.
Yeah.
But this side, no big deal.
Nope.
Clench super hard. Now open big. Clench super hard. Now open big. Perfect. Really hard. Break off. And open. Perfect. Bite home hard. Break left. Open big. It's gonna get a little messy. Yeah, just scary. Left. Open. Here, back. Section and ribbon. Tender?
Oh, not quite as tender.
Not as bad?
Yeah.
What's this guy like?
Yeah, just like a finger.
Just like before,
Yeah.
right? So he's a little easier on
Yeah.
finger, and it's still the same, no big deal.
Yeah.
Check around. Remember you were saying you were tense, tight?
Yeah. It's tense all the time.
Is it still?
No, it's not quite as tense.
A little different.
Yeah, it's a little bit, a little looser.
Awesome.
I'm feeling a little bit.
A little difference already,
Yeah,
right?
a little bit of difference already, yeah.
Yeah, we're not even done with one side. Okay, home, left.
Okay.
Is that different?
Yeah. Doesn't feel like I'm having to shift or anything.
More natural?
Yeah. It is significantly better.
Yeah.
I didn't think I would ever be able to do that.
Longer than
than before, yeah.
Yeah, well, it's a good
Like-
sign. We're not quite done, but we're close. Are
I
you
feel, like
wore
I'm
out?
I feel like I'm really gonna sleep well tonight.
You've been watching too many of my videos.
No, I don't even know if anybody ever said that, but man,
yeah.
I just feel like, wow, I'm gonna sleep.
You're wore out.
I want to sleep.
In a good way. It's probably... yeah.
And you didn't even work out last night.
No, I'm talking about you. Dude.
Oh yeah. Oh, I thought you were talking about yourself.
No.
Oh, sorry.
Just talk
Yeah,
to me,
it's
Joe.
it's smoother. I feel like it's there's just more teeth there. So
Yeah.
it just feels different, I guess.
Yeah.
But it's not
Not a bad thing.
a bad feeling.
What's your face feel like?
I feel relaxed. I feel kind of neutral.
Sleepy?
Yeah. Yeah, I do feel a little sleepy.
Good for you.
Yeah.
The face flushed? Anything different? Loose?
This feels actually this feels a little bit more relaxed just right through here.
Yeah.
Yeah.
That's awesome.
And this feels a lot more relaxed.
And your right side was your problem.
Yes. Yeah. So,
Compared to an hour ago, What's it like now?
Like if it, well, it was like always a dull throb. Now I don't really feel it. I'm really tired. Like I don't,
That's normal.
but I feel like there's just a release overall, just on my whole right side.
So that was where the pain was.
Yeah,
When you walked in, that was your
yeah.
chief complaint.
Yeah.
You feel like that's been addressed?
Mhm. Like I feel relaxed.
That's
totally
awesome.
relaxed.
Move your neck around for me, please. Is it different?
Yeah, I feel like there's nothing,
Nothing stiff.
nothing stiff, where I just feel like that's all released and
So is
pretty
that
neutral. Yeah.
is that an unusual feeling for you, or?
Yeah, but most notably, I think is my right shoulder. I feel like it always felt like I was constantly doing a push up, like just with my right arm. Like
Yeah.
it was always tense.
And right now?
I don't feel anything. It's just complete. That was the most noticeable difference to me. That and this.
That's awesome.
Yeah. But all that soreness is gone. I mean, compared to how I came in, I feel like it's like a lockbox now.
Yeah.
Whereas before, it was just kind of this loosey-goosey.
A free for all.
Yeah.
Wherever you want to go.
Yeah, there was no, I mean, you're talking about, bite home. There never felt like a home.
Yeah.
Everything is there.
They look good.
Well, it feels great.
Yeah.
I feel totally relaxed.
Good.
Yeah.
Good thing, right?
Yeah, it's a new feeling.
Are you glad you had it done?
Absolutely. Yeah.
She's waking up now.
Yes. Absolutely.
Okay.
Yeah.
I'll
I'm gonna
see you
tell all my
soon.
friends. You're gonna get lots of people coming out here to Branson.
And we're not.
Yeah.
You created your own bite, as I fixed you today,
Uh-huh.
and we tracked the muscle over time. We use Kirsten's research plus a little bit of what I do that's a little bit different to dial it in, and the muscles show us that they're happy and you're relaxed, right?
Yeah, totally.
Yeah.
Yeah, I don't feel, I mean, it's,
The reason you're here is addressed, am I right?
yeah, absolutely.
Okay.
Yeah. Yeah, totally. I'm like, oh, yeah.
But she falls asleep.
Uh,
Guys, let her go so she can take a nap.
yeah, it feels good.